The New York Times' Robert Pear yesterday reporting that the administration has offered up a proposal to cut Medicare and Medicaid $100 billion over 10 years. Most of those cuts taken from healthcare providers like hospitals and nursing homes. According to the article, it says that a coalition of hospital lobbyists worried about the direction of the budget talks has begun a national advertising campaign to block further cuts in the two healthcare programs, which account for about 55% of hospital revenues. The hospitals have made a commitment to spend up to $1 million a week through August on television, print, and online advertising. Are you part of this coalition?
We're not part of that coalition. We are devoting, as you mentioned, a lot of resources, and we're running ads on WTOP this week. We did last week, the week before, drive time ads. We have run ads in targeted congressional districts on health care, Medicare changes, cuts.
Can you give us some of the districts that you're running them in?
We ran them in 2 districts in Florida.
With a Republican or a Democratic incumbent?
Republican, but we've run them in Democratic districts as well, in Congressman Schuler's office, and Heath Schuler in, I believe it's North Carolina. So it's Democrat and Republican. Mine also say, I know people paid a lot of attention to the special election in New York, and we were involved in that. I went up there and endorsed Kathy Hochul, the winner. We contributed. We have a political action committee. We contributed to her campaign. We did independent expenditures. We did radio ads. Why? Because Medicare was such an important issue in that congressional race. Not because we're an arm of the Democratic Party. In fact, in that district, in the past, we supported the Republican from that very district, 2 of them in the past, with our town meetings and with our political action committee. So our involvement in politics, and we are a grassroots education advocacy organization, but we're also very political. We follow where members of Congress stand on the issues that are so critical to seniors.
One last phone call here for you. Joseph, Democrat in St. Clair Shores, Michigan. You're on the air.
Oh, yes, thank you. I would just like to make comment about the Republican-sponsored bill that happened, I guess, a couple of years ago for Medicare prescription expenses. And this had no cap for the providers of the prescription drugs. And it was a vote that was forced down. As I recall, it was a vote that was just very, very forced down the throats of the other party.
All right, Joseph, we're running out of time here, so let me ask our guest to respond to what you had to say about that.
Well, that vote took place at 6:30 in the morning. I stayed up on the Hill till about 3, and then I went home and watched it on C-SPAN, where I could relax a little bit. But it won by, I think, passed by 1 or 2 votes. And I mentioned this at the beginning of the program. One of the most serious flaws in that bill, besides the fact that it wasn't paid for, which is pretty darn serious, is that, and that's what the caller was referring to, the pharmaceutical industry was able to insert in language in that law that prohibits Medicare from negotiating for the best price. I think that's unconscionable. And a bill that is going to provide prescription drug coverage, some, not perfect, but some, for nearly 40 million people, and you're not allowed to negotiate the best price. The VA does it. This was a special interest provision that needs to be changed as soon as possible, and it will save an enormous amount of money. If we want to save money out of Medicare, that's the first step, I think.
I want to get your thoughts before we let you go here on this headline in the Washington Post. Medicare chief has timer ticking down the months. His recess appointment, referring to Don Berwick, has him in the race to carry out key health care jobs. Do you endorse him for the job?
I don't know Mr. Berwick. We were not asked to weigh in on that, but from everything I've heard, from everybody who I've heard it from, he has tremendous credentials and has done a wonderful job at the Medicare program. I'm sad to see what's happened with someone with that background for whatever reason, I don't know what the motivation is, but he should have been confirmed and not subject to this kind of discussion because a recess appointment was made.
A year ago this week, he was put into the job during a recess appointment. Unless the Senate acts, he cannot stay beyond December. Max Richtman, thank you for being with us.
Thank you for inviting me.